another major medical breakthrough is giving hope to those suffering from cystic fibrosis. Have a look. Cystic fibrosis is a debilitating disease that causes problematic mucus to build up in the lungs. There is no cure, but the FDA recently approved a new drug that has cystic fibrosis patients gleaming with hope. The combination therapy drug is taken orally and is applicable to 90% of people suffering with CF. Results claim the drug helps relieve symptoms of the sometimes deadly disease. So does this new wonder drug mean there is finally hope on the horizon for people living with cystic fibrosis? We have Dr. Patricia Ashagian, the Adult CF Program Director at UCLA, joining us to weigh in on this. This is so exciting to hear about something giving hope to CF patients. Can you talk about this particular drug?
This drug is just a tremendous breakthrough for patients living with cystic fibrosis. So as you just heard, CF is a rare genetic disease, and it is a progressive disease. And ultimately, the organ that's usually the most affected is the lungs. And they develop thick, sticky mucus that builds up in their lungs. And patients often feel that they're breathing through a straw. They have to do multiple treatments a day to try to get that mucus out of their lungs. They get frequent infections in the lungs, they're hospitalized frequently, and ultimately the lung function declines over time and the damage to the lungs is permanent. So this drug is so exciting because it brings a treatment actually to the underlying genetic cause for the disease. So people are lacking a protein in their body, and the drug is a pill that helps them actually make the protein a functional protein that's either dysfunctional or that they just don't have. And so what's so exciting is that now this drug will become available to 90% of people with cystic fibrosis because it treats the most common underlying genetic defect, what we call the F508del genetic defect. So anyone who has one copy of that gene will be a candidate for this drug. So that's one reason why it's exciting. The second reason why it's exciting is because of the clinical data. And the clinical data shows that there's a 10 to 14% improvement in the lung function measurement that we follow when you have CF. And so over time, each percentage point in your lung function matters. And so if you can bump up your lung function by 13 or 14%, that's huge.
Without this drug, Dr. Ashagian, what's the typical life expectancy of someone afflicted with cystic fibrosis?
So currently, the median survival for life expectancy in the United States is somewhere around age 40 to 45 with cystic fibrosis.
And if you're improving lung function, theoretically, you're probably reducing hospital stays, improving their quality of life. You're a child adolescent psychiatrist here. I can't even imagine the hope that this provides a child who previously didn't really have any great treatments. So everyone wins here, but mainly they're getting their at least parts of their lives back.
Absolutely. I mean, this drug is going to change the way people are able to live their life with cystic fibrosis. It won't obviate having to do all the treatments otherwise that they do to treat the symptoms of the disease, but it'll allow them to hopefully live longer, less time in the hospital, slower rates of lung function decline over time. And so,
and give them what be available.
It is available. So this drug was just FDA approved this past week, and we'll be able to start ordering it soon.
And always the big question, is it going to be affordable? Will insurance pay for it?
Great question. So the drug is going to cost about a little over $300,000 a year. Our hope is that insurance coverage will be quite good for the drug. I think that insurance companies will be motivated to pay for this drug because it'll help patients live longer and keep them out of the hospital.
And it does highlight, when we have someone on this show, and this is what you do, and you're this excited about it, it makes me excited about it, and I'm excited for everyone out there living with cystic fibrosis. And thank you for sharing this with us and for the work that you do with cystic fibrosis patients.
Thank you.